So let's discuss overall spinal health and some red flags that would make a person go see a doctor like yourself. So in addition to back pain, what are some other red flags people should look out for?
Okay, so here this is sort of a vague list of red flags. So pain in the extremities or more weakness in the extremities is a red flag. So oftentimes when we have a herniated disc, that will compress a nerve root and it will cause focal pain. But it's more really the weakness or the numbness that are more of a concerning feature versus just the pain itself.
Okay.
Unwanted weight loss, fevers, chills, and sweats, that more points towards a malignancy, and that could be something that would be metastatic cancer that's gone to the spine or a spinal tumor that's happened de novo, okay? Groin numbness and incontinence, usually the classic thing that we talk about is fecal incontinence and urinary retention. So what you would have is you would soil yourself and you would go to the toilet and you would say, okay, well, I've soiled myself and I actually hadn't noticed the stool coming out. That's very different from patients who say they can't make it to the bathroom on time but have the sensation of emptying.
Right.
Or urinary retention, which means that they're going and they're going and they're going, but they never really fully empty the bladder and get something called overflow incontinence.
Right.
Which is where, you know, your bladder is so full that essentially it just sort of empties itself. So it's not really urinary incontinence so much, it's the fact that you can't empty your bladder.
Got it. But at what point, looking at these red flags, are they indicative of like something that may need surgery?
So any of those red flags, for example, fecal incontinence, urinary retention, numbness or weakness in the legs, those are not something that we try a non-operative treatment for. That's generally find out what the problem is with imaging, so the x-rays, CT scans, and MRIs, and then proceed with operative intervention. Because once you've developed the neurologic deficits, which is what those are, it's really, there's no role for conservative management at that point, if the patient is fit for surgery at all.